Medical Racism in U.S. History, Part 1. From the 1930s, the U.S. government intentionally let hundreds of black men die from syphilis. It was part of a medical study that claimed they would get free health care. The Tuskegee syphilis experiment was run by the U.S. Public Health Service. Researchers recruited 600 black men in Alabama in the 1930s and tracked them for 40 years. They promised to treat them for a condition called bad blood, but researchers were actually studying the full progression of syphilis and didn't give the men who had it any real medication. They gave them aspirin or placebos even after finding out penicillin can treat syphilis by the 1940s, and they told local doctors not to treat the men. The study was only shut down after a researcher leaked it to the press in 1972. At least 128 men died from syphilis or related complications. The disease was also passed on to about 60 of their wives and children. The government only apologized 60 years later. Doctors say the study led to huge mistrust in the black community of the U.S. health system and clinical trials. Medical racism still persists today. Black adults are more likely to be underprescribed medication and 4 times more likely than white people to experience mistreatment while seeking care. Look for Part 2 about how in the 1940s the U.S. government infected almost 700 people in Guatemala with syphilis for another experiment without their knowledge.